What's up, you guys? It's your boy Miguel giving you your daily dose of radiation. And today's video, we are covering how often do you have to hold the Xray board / patient to acquire the magnificent radiation pictures. This video is mainly for the students, those who are coming new to this field, or people who are curious about radiation and the X-rays. So, to give you some context, I do X-rays graveyard. I work at a level 3 trauma center. There's only 2 of us for the whole hospital. So, depending on your partner in crime, as we call it, the radiation holding game will vary. So, what do I mean by this? If your X-ray tech partner is a female and she is pregnant, most likely, we do wear lead, yes, but most likely you would not make her hold the, that you'd feel bad, because she's pregnant, and we already know the radiation, so it might lean more towards you, who is not, bearing a child. But if you're just in a normal situation, most of the time it goes kind of 50-50, or it all depends who's because at some point it's just kind of whoever's pushing the X-ray machine, the portable, and the other one who's not, who gets in there, who's talking to the patient, will kind of, give it to me kind of situation. That's most of the time, that's kind of how it is. You don't even really keep track of who hold it, who don't. You just kind of, whoever's closer to the lead or whoever. It kind of based on different situation. But if my partner's been doing it all day, I'd be like, all right, bro, I'ma hold it. Come on now. You've been, that's kind of unspoken rule, amongst your peeps. Because there's other people who I hold it last, they'll have to go back and back. So it kind of depends on your partner. But anyways, so most of the time, you'll hold for babies. It all depends. If it's a dad, most likely a dad will be easier to work with, because he'll be hold the board, let's get this stuff done, in and out type of situation. So the dad will help you more. Sometimes with the moms, if they're pregnant, well then you'll have to hold the little baby. And then sometimes it's, if they're really, really feisty babies, it might take you and the parents to hold them down if they're screaming and moving and stuff. It might be a 2-man job on those situations. Sometimes, if it's a Truman Smith baby, which for those who are not familiar, those are some of the kids, or older ones who have a medical condition. You can Google up. I ain't going in terms, but those, if they're moving a lot, most of the time, at least where I work at, they don't have their parents with them. They're kind of by themselves. So that sometimes that is 2-man job for those. But we always try to only keep it at 1, unless it's absolutely necessary for both of us to do it. Sometimes on the floor, if you go up to the floor, they'll order a foot X-ray. Sometimes the patient can't exactly move because they just came out of surgery and they need X-ray. So you're not going to tell the patient with one of those giant boxes that looks like it comes from Saw with a bunch of needles stuck in. You're not going to be like, yo, sir, can you? No, you're not going to rotate it, move it. You're going to cross there. And sometimes they can't really move because they literally have all the setup holding everything. So you'll have to hold it. Also for necks, sometimes they come out of surgery and they'll have to do I think it's post, I think it's ASF, I think that's the abbreviation, I can't remember what they abbreviate, but basically they want AP lat of the C-spine, so we'll shoot them on the floor and we'll just hold, for the lateral. that is something that we'll do. Or in NICU for the babies, if they want a lat, sometimes they want laterals. And I mean, the parent sometimes can help you, but other times, since we shoot in the middle of the night, they're kind of asleep and passed out. It's kind of our job to, it'd be sometimes faster for us to hold it to get in and out. Reduce the baby, crying and getting upset type of deal, I would say. What else? When you're in the emergency room, traumas, that's a big one. Most of the time we'll end up holding, if you're trying to do, mostly for lower extremities and upper extremities, if the patient has had pretty bad trauma where their stuff's broken. You can tell right away when something's pretty damaged, and you're like, okay, we're not gonna move, or okay, we're gonna angle the tube instead of moving the patient type of deal. The tube type thing to reduce, further damage to the patient. So those cases will do it. Sometimes with little kids who don't follow instructions, you may have to, hold their little hands or feet, so that will happen from time to time. Where else do you hold? It's mainly the little kids that will get your day in and day out. Those kind of require most of radiation. The little kids or the traumas that take more damage. Or cross table, sometimes you do cross table if it's really broken. Gotta get creative out there. But yeah, those are the main situations that you'll hold for patients. And yeah, I hope you enjoy your daily radiation. And see you.